Welcome back to another episode of Black Facts. Today, I'm going to be talking about physical therapy or exercise as medicine. Today, or actually this month, is Physical Therapy Month. So I'm so excited to have Dr. Danielle Wortham here with us to talk about, like I said, exercise as medicine. She is a physical therapist and is currently practicing in a private owned physical therapy clinic. So I'm excited to have you on because I first of all, I didn't know October was physical therapy month. You know, it's all the rave about, breast cancer awareness. And so it's really nice to know too that there's a month for physical therapy and talking about the importance of being physically active. So I want to jump right into it. Can you please explain to us what is physical therapy?
Yes. So first of all, thank you for having me. I'm very excited to be here. As you said, October is National Physical Therapy Month, and a lot of people don't know what physical therapy is. So basically, physical therapy is a branch of medicine that focuses on physical rehabilitation, focusing on exercise. And it's
Okay.
so amazing how exercise can play such a large role in rehabilitation, but also just getting you strong and active and controlling all kind of other processes that go on in the body. Um, Physical therapy is a field that is in all different settings, but my personal setting is the outpatient setting, which is fun. So it's usually people that have had knee replacements, hip replacements, and all kind of other injuries or surgeries, and they come to me, and I take them from here to there.
Okay.
So it's very exciting, and I love to educate people about physical therapy.
Okay. And I was just getting ready to ask you, so what types of people come into your office? You just said something that, people that need that have had hip replacements. What
Yes.
other types of individuals come into your office?
Oh my goodness. So, like I said, mainly the orthopedic surgeries are very popular with physical therapists, the shoulder surgeries, the back surgeries, the knee replacements, ankle surgeries. But I see everything. I see people who were playing football last weekend and, they're holding on to those dreams and they get an ACL tear, or they're the little old lady who wants to hold on to their independence and they picked up a big case of water and they say, honey, my back is killing me. I'm like, what were you thinking? But I just everything. I see the children, little kids, even 8-year-olds, 9-year-olds who are playing soccer or football
Wow. Okay.
and hurt their knee, and I see everything in it. But it's so wonderful. And I have to say, since it is Breast Cancer Awareness Month, I do see a lot of women who have had
Hmm.
mastectomies, and
Okay.
because of the mastectomy, it can cause limitations in the shoulder joint. So I am always so humble and just so compassionate when I see them, because it's a lot. It's a lot emotionally, and
Yes.
it's a big change, an unexpected change. So I do see the women that have had the mastectomies to help get their range of motion back and get their mobility back in the upper body.
Wow. Thanks for sharing that.
Yeah.
I didn't even think about, physical therapy in that context about really
Mhm.
kind of helping them, breast cancer survivors to get stronger so that they can move
Absolutely.
forward in their recovery.
Right.
So yeah, thank you for
Yeah, because
sharing
if
that.
you think about it, I mean, like you say, you don't think about it, but we take so many movements for granted, and me being in this field has gave me such an appreciation of the body and how it works. But imagine if you can't lift your shoulder.
Right,
You can't
right,
comb your hair. You
right,
can't even put deodorant on. They're
right.
just simple things that you take for granted that you just can't do. So it's so important that we take care of ourselves. But then when we do have something that does happen to a person, then you have us who help to get you back together.
Okay, good. So tell me, how can physical therapy help me?
Okay, so physical therapy is, like I said, a broad field, but we are considered the movement experts.
Okay.
I'm a movement expert. So if you have a problem, let's say you went to the gym last week and you were a little overzealous, which I see all the time, and you hurt your back. So you come to me and say, oh, I was working with someone, or I tried to do a deadlift and I hurt my back. So I will then come in and I'll assess you and ask you a few questions and see exactly what the source of the problem is. I will
Okay.
then create a treatment plan, and we will implement that treatment plan. Now, for me personally, modus of my favorite mode of treatment is exercise, of course. Some therapists, you have other techniques, and I do use other techniques, but my favorite is exercise. I tell people the machines are nice, but I'm getting you in the gym. Oh no. But once they start exercising, even the ones that are kicking and screaming, after 2 weeks, they just tell me, honey, I feel so much better. Thank you for forcing me to exercise. So it's really been an eye opener for me. Like I said, when you just do 2 weeks of consistent exercise, has to be consistent,
Okay.
you will see a difference. And
Now,
like I said, sometimes I'm blown away.
when you say
Sometimes I'm like, wow, I really didn't think they were going to get that strong that fast. But I have seen it. And when you are dedicated and you put the time in, I promise you'll see results.
When you say consistent, does that mean every day or like?
Yeah, that's a good question. So it doesn't have to be every day, because typically in my work, I see people 2 to 3 times a week, but I do have them do a little bit at home every day. I said, oh, I'm so busy. I said, I know you're busy. 10 minutes. 10 minutes is all you need. Just do the few core exercises. Just give me 5 exercises. I promise you, you will see results. And they always do. And they're so excited. So once they start to see the results, it's like addictive. They want to do more. So that's really awesome when I see that.
Okay. So you just said, how you can help me. So I want you to actually take me through. We're going to take a little bit of a break, and I'm going to get in position. I want you to take me through a couple of, like 5 to 7 minute, exercises that I can do so that I can, stay physically active. I mean, I pride myself. I do get out and walk and, slight jog, run sometimes when I'm feeling, like my old track star days, I'm like, oh, I can, and then I have to back off of it so I don't.
Right. Know your limits.
Right.
So the first one that you're going to do is one of my favorites, because I get a lot of clients that work at a desk all day. Okay. And so I say, well, you work at a desk all day. So, what's going on? Oh, my back is killing me or my neck is killing me. Well, how often do you move during the day? None. Zero movement. Go to the bathroom, get some food. So this is a really good exercise that I have people do just to get the blood flowing and to get the legs moving. So I'm going to have you have a seat in your chair. Okay. Excellent. So all you're going to do is stand up and sit down.
Oh, okay.
Uh-huh.
Do I need to do anything with my arms?
Up, if you can see my arm. Uh-huh.
Okay.
Yes, exactly. And just stand up. Exactly. And sit down. Exactly. It's like a modified squat, but you're still getting some movement. You're working your hips, you're working your knees, and you're getting the blood flowing. Okay, excellent. And your speed is perfect. So my rule count is up 1, 2, down 1, 2. Good. So you've already done like 3 or 4. Let's do about 10 of these, because these are really, really good.
She's gonna work.
Now, I do have to say, if you do have a history of knee pain or knee injury or hip injury, you might want to maybe just do a few, or just do a couple to see if it does exacerbate your pain. And if it does, then I wouldn't recommend these. But if you have no history of knee, ankle, or hip injury, then this is all for you. Okay. And I would do this every hour. Just do 5 every hour. Okay. It literally takes like 2 minutes. Right. Excellent. That was really good. Your form is perfect.
Oh, thank you. So I can set a timer then on my watch, or either on my phone, like every 5 minutes. Like you said, I'm sitting at a desk and I can just get up and do 5 of these. You said like
every hour. Just set a timer, or the top of the hour, just do 5. Okay. But sitting at a desk all day is very detrimental. People don't realize how much it affects the posture and how weak it can make you, especially if you're just getting up just to go to the bathroom and to get something to eat. So this is a really good exercise. Okay, so the first one that we're going to do is one of my favorites. It's called bridging. So go ahead and get on your back.
Let me do
perfect. Oh, I love your mat. You're ready.
Okay, so
get on your back for me, and you're going to bend your knees.
Okay.
Lay down on your back.
Okay.
You're bending your knees. Perfect position. So bring your feet out a little bit. Walk your feet out. Yeah, right there. Okay, perfect. So this motion is lifting the bottom up off of the ground, off of the floor. Lift up. And then come back down. Perfect. perfect speed. Again, we're doing the 1-2 count. Okay, lift up, excellent, and come down. Oh my gosh, your form is perfect. Make sure your head stays on the floor, on your mat. Okay, that was 2. Go ahead and lift up. Excellent. So this is really good. Keep going, Michelle. I'm going to talk while you're doing this. This is really good for not only the core, but for your glutes and your hamstrings. And especially the ladies always ask me, honey, what can I do to kind of firm up my backside? This is a good exercise for that. Okay, perfect. How does that feel?
It feels good.
Feels good.
And I'm happy to know it's firming up my backside.
Yeah, and you'll really feel it in your hamstrings and the muscle on the back of your thigh. Now, in order to make this harder, so after you've done this for maybe a week or 2, you may say, hey, this is getting kind of easy. A way that you can make this more difficult. Now, this is going to be a challenge, and the intensity is pretty high, but you would do one leg bridge. Okay, yeah. So I'm just going to have you maybe go through one, extend that left leg.
Okay.
Yes, keep it there and lift your body up.
Oh,
yeah. I just wanted you to demonstrate that one time and come back down.
Oh, yeah. That you feel that.
Okay. Yeah. So you don't have to do a lot of those because that's the advanced version, but that's pretty hard. So once you've done bridging for the 2-leg bridging for like 2 weeks, maybe even 3 weeks, you may feel like it's a little easy, and that's how you can increase your intensity.
Okay, perfect. Thank you.
Okay, so the next one, let's do the bird dog. So go ahead and get on your hands and knees.
Okay.
Excellent. So let me just explain to you before you do it. So this motion is just, you're lifting up your arm and your leg, opposite, right arm, left leg at the same time.
Okay.
Opposite. Is that opposite? The other opposite. Exactly. And bring it down. Slowly. Okay. And then the opposite, the left arm and the right leg. Exactly. Your form is perfect, but I see you kind of wobbling a little bit. You're a little wobbly, and that's totally normal because you have to stabilize yourself using your core. So again, this is another core exercise and a good glute exercise, your tush. But yeah, so this you can be a little wobbly if your core is not very, very strong. It can give you a little wobble, but as you do them more, then you'll get firmer. That's perfect. Perfect. How does that feel?
It feels good.
Feels good? Yeah. I love these exercises. And when I'm working, I typically like to incorporate exercises that use more than one muscle group. And yeah, more than one muscle group. And instead of just doing, you're doing a hip extension or hip flexion, we're incorporating the core, we're incorporating the arms, we're incorporating the legs, and also doing a little bit of balance. So that is perfect. I love it. Okay. So you've done great so far. How do you feel?
I feel good.
You're good. Okay, you're doing great. So I want to show you a really good stretch. Out of all the stretches, this is probably one of my favorites. I do it myself after a really vigorous workout or at night even before I go to sleep just to help relax me for the day. Okay, so I'm going to have you face your wall. You're going to bring your bottom towards your feet.
Okay.
Yes, and then lean forward and your arms are straight like Superman. Exactly. You're going to stay in this position for 10 to 20 seconds. And breathe in deep and breathe out. Breathe in and breathe out. This should feel really nice. Exactly. This stretch is also done in a lot of yoga classes. But I like to do this stretch for my clients after they've done a lot of core work. And then, like I said, for me, after I do a vigorous workout, you can come up now, Michelle. So any stretch that you do, you want to hold about 10 to 20 seconds. And make sure that you breathe. You don't want to hold your breath. So it's a nice breath in, inhale, and then a nice breath out, exhale. Okay.
And
do I go up? Come on back.
Okay.
And then come on back. Good. And you can start here. Breathe in. And breathe out. Breathe in. And breathe out. Excellent. Good. This is so relaxing. And it's stretching the hips, the thighs, the ankles, the back, everything. Excellent. You can come back up now.
So what if I can't get all the way down?
If you can't get all the way down, just go down as far as you can.
Okay.
Just to your tolerance, and then you can just stop there. And to make it more comfortable, you can even maybe put a pillow between your
Oh,
bottom and your feet to make it a little
okay.
bit more comfortable for people that can't go all the way down.
Okay. I'm gonna do
Okay.
it again because it does feel good.
Right. Yeah, exactly. It's addictive. I mean, I don't feel like we stretch enough, even for me, I exercise a lot, but I feel like I don't stretch enough. But when I do, it feels absolutely amazing. So stretching, and I'll talk about that a little bit later. Stretching is vital in keeping us nice and healthy, our joints and our muscles. Especially in combination with the deep breathing. It feels amazing. Those are just 4 quick exercises that you can do. But like I said, I like to incorporate exercises that use more than one body part. So you don't have, I mean, of course, working out 30 to 45 minutes is optimal. But if you don't have 30, 45 minutes, take 10 minutes and do a few good, really good core exercises, leg exercises, and that'll even make a difference. It'll make a big difference.
Well, yeah, I feel really good. Like,
You
no,
feel like you had a
seriously,
little
like I
workout,
feel
right?
I'm not just saying that. Like I really feel, like good and stretched out, and I can feel like where I've been, just those few simple, movements that you put me through. Like I can feel it.
That's awesome. So remember, but when you're doing them in your regular life, you're going to do those first 3 exercises like 20 times and maybe
Okay.
even 30. So you're
Okay.
really, like we just did an example here, you did about 5,
Right.
but when you're doing them actually every day, you're going to be doing 20, 30. So you're really going to feel that.
So if I'm doing those exercises, would you recommend that I do like so how many sets should I do of each of them?
Exactly. So I usually do one set is 10 repetitions or 10
Okay.
times.
Okay.
So I usually recommend people do them 2 to 3 sets of 10. So 20 or
Got
30
it.
reps.
Okay.
20 or 30 reps. If you're just starting, I would say 20.
Okay.
If you're just starting, I would say 20. But as you start to get stronger and more confident, then I would definitely bump it up to 30.
Okay. And I like that you showed me some modifications for some of them. I need to, stay in my lane right now. I'm going to just do the ones how you
Modifications,
showed me how to do
yes, I'm
them.
so
And
glad you
then,
brought that up because modifications are perfect. People say, well, I can't do it like you. You don't have to do it like me. Do it like you do it because eventually it's going to get better. If, like I said, if you just do an exercise for 2 weeks, it's your strength, your range of motion is going to get better. So eventually it will look like a pro. But if you cannot do it perfectly the first time, do not worry. You're going to get there. I promise. I see it
okay.
every day.
I'm excited. Well, I
Yeah.
hope everybody is watching, and I hope that you all try these exercises. I promise you, you will feel it just a little bit that you just saw me do. I definitely feel it, and I feel good. I feel like I've been stretched out, and I can definitely feel it in my, my hamstrings and
Your
my
quads and
gluteus
your glutes.
maximus. Yeah.
That's perfect. That's perfect. I love it.
So, can you tell me 3 things that you'd recommend that the viewers and I do to maintain our physical health?
Absolutely. So the first thing I'm going to go with is aerobic activity. So aerobic
Okay.
activity is typically the longer exercises, biking, walking,
Okay.
running, swimming, rollerblading, kayaking. The American Medical Association recommends that we do at least 150 minutes of moderate exercise every week.
Oh, wow. Okay.
At least 150 minutes. Now, the numbers go from 150 to 300 minutes. The 300 can be a little daunting for some people. So when I say 150 minutes, I say don't freak out. I said when you break that down, that's just 30 minutes, 5 days a week.
And
30
anybody
minutes,
can do
5 days
that.
a week. You can do that.
Yeah.
And we can even go a step further. You can break that down. You can do 15 minutes in the morning, 15 minutes in the evening. That's 30 minutes.
Yeah. No,
That's
that's
that's 30
doable.
minutes.
That's
So
doable for everyone.
that's totally doable. It's totally doable. you just gotta move. You gotta move. So that's one major thing, the 150-minute rule. The second thing is what we just did, and I talked about a little bit: stretch, stretch, and more stretch. So stretching is so important in maintaining our physical health, especially specifically for our muscles and our joints. Stretching has a lot of benefits, but the three main benefits that I love is stretching helps you to be able to perform your best at any physical activity.
Okay.
Okay, so basically optimizes your physical activity. Stretching, and this is a huge one, helps to reduce the risk of injury. Okay, so as we get older, we're more prone to injury because our, changes start happening to our joints and our muscles. But if we are consistent in our stretching, that risk is definitely reduced.
Okay.
And the third one, which is my personal favorite, it reduces stress.
Yes.
Yeah. Right? Can you imagine
Yes.
doing what you just did for like 10 minutes, just like maybe 3 or 4 different stretches?
No, absolutely. And I'm going to start doing them seriously,
Yeah.
because just that short amount of time, I wish I could really convey. I do. I just feel more relaxed and
I
stretched out. I
can't,
don't know how to
yeah,
explain
can't,
it
I
better
can't,
than that, but definitely going to do these.
yeah, I can't stress how important that is. And I'm going to be honest, like for me, stretching was never my thing. Like I would work out and I would, embarrassed to say, I'm a therapist. I work out pretty vigorously and I wouldn't stretch. I'm like, what are you doing? So now I've incorporated stretching prior to my exercise, and then afterwards, it's like the cherry on the sundae. Like it makes all the difference, and it just like completes your workout. So take time. You don't have to, and you don't have to do it 30 minutes. Do 2 stretches before you work out, depending on what type of workout you're doing. If you're doing a predominantly like a leg workout, like for example, I walk and I run. So I'll do a nice stretch for my quad and my
Okay.
hamstring and my calf. But if you're doing an exercise that's primarily for the upper body, then do a nice arm stretch, stretch your biceps, your triceps, the side muscles. So you want to stretch primarily the muscle group that you're working with.
Okay.
And the last thing, if you forget everything I said today, I tell my patients, my hashtag is just move. Just move. They always ask me, well, what should I do? Do what you like. Whatever it is that you enjoy, because if you enjoy it, you're going to do it. If I tell you to do something that you don't like, you're not going to do it.
Right.
In my experience, I've learned to meet people where they are. So there's no right and wrong. It's do what you enjoy. I enjoy walking. I enjoy being out in nature. I enjoy being in the sunshine, getting the vitamin D in the fresh air. That's what I love. I'm not a gym rat. So I do that every morning. That's what I enjoy.
Mm-hmm.
If someone told me to go to the gym to work out, I'm not going to do that. So I want you to do whatever it is that you enjoy. Do it consistently. Be consistent. Do it regularly. Your body will adapt. Your body will strengthen, and it will definitely respond to your exercise. It will help to keep you lean. It'll help to keep you flexible. It'll help to keep you strong, and it'll help to keep you healthy. And I want to also throw this in. So ever since COVID, I've been doing a little research. The obesity rate in this country has shot up. Because you would be surprised how many people just did not leave their house, period.
Oh yeah.
Yeah, they didn't go out of the house even to take a walk. They just were afraid to walk out of their front door. So I say about half of my patients now are people that just did not leave the house. So they have just become so inactive and so weak, like they don't even know where to start. So they come to me and say, I don't know where to start. Are you before COVID? I worked out every day, but after during COVID, I didn't leave the house. I'm like, wow, okay. So the obesity rate, diabetes, hypertension, exercise can help control all of that. That's where the exercise as medicine comes in. Exercise can help prevent and control hypertension and diabetes. And we know that that is prevalent in our community.
Yes, absolutely.
Right. And I'm so passionate about this because I tell my patients, just get out and exercise. If you have diabetes, if you take a 30-minute walk, you'd be surprised how that'll affect your blood sugar level. You'll be surprised how it helps to control that. And I had a patient once, which is going to be a really quick story that I'll never forget it. So she came to me because she had another problem. I think it was back pain or something, but she had diabetes. So I, told her my spill on exercise is great for the sugar and how you really need to get out and exercise. I said, even if you can't do 30 minutes, do 15. But 15 turns to 20, turns to 25, turns to 30, and you're gonna feel so much better. And it'll also affect your sugar. So she went to her doctor maybe about a month after she was seeing me, and she almost ran to the clinic for her next appointment. She almost ran and just hugged me, and she said, "Oh my gosh, my blood sugar is just so much better. It's normal, and I'm so excited. My doctor's so excited." And I said, "Oh my gosh, that makes me feel so good." But it's not me. It's just
Mhm.
education. It's all about education. I just want everyone to
Absolutely.
know how important exercise is, and just it's a natural way to stay healthy. So just move, just get out there and take care of yourself. Take the time. Trust me, your body will thank you for it.
Okay, well, I'm gonna steal part of your let's move. I'm gonna say hashtag let's take it outside, hashtag let's move.
I like it. Let's take it outside.
Because
I
we
like
need
that.
to get outside too, right? We need to get outside and get some fresh air. And,
Yeah,
we're still in the era of COVID, and I think
right.
people are still a little fearful about being outside. And I too, I'm not like a gym person. I'd rather go outside, go to the park, walk, run, jog. And you have, how shall I say, you have motivated, encouraged me to do it the correct way, because now I will stretch. I can't say that I've been consistently stretching. I'm just like, okay, I'm getting up and I'm getting out there, right?
Right, right,
And
right.
so now I am going to be consistent about my stretching. And since I just enjoyed my stretching activity now, I definitely will do some of those in the beginning and then end my walk, jog, run with some of the other ones that you showed me. So I'm excited. I'm excited
I'm
to get moving, and I think I'm gonna after this episode. I think I'm gonna go.
you're gonna continue your
Yeah,
stretches.
I'm gonna
I
do
love
my
it.
well. I'm gonna do my hashtag Let's take it outside, and I think I'm gonna go on a got me feeling good. So I think I'm gonna go on another walk today.
Oh, I
Um,
love it. It's really pretty outside today. But you said something that I do wanna piggyback on, and it's gonna be very short. So yes, we are still in COVID, and so many people are scared to go back to the gym. Yes, exactly. But you can go outside. You can
yes.
just literally, you don't have to pay for a membership. You don't have to do anything special. Put your tennis shoes on,
Mhm.
put your workout clothes on, literally walk out your front door and walk around your block a couple of times. You will feel so much better. So thank you for mentioning that, because we are not done with COVID. And a lot of the gyms are now open, but a lot of people are still very wary. And I would be wary too to go back at this point, just because, you want to be cautious, but don't let that keep you from doing anything. Get
Yes.
out there and take a walk. While I'm walking, I'm taking the deep breaths. I'm expanding my lungs, and it just feels amazing. So I'm excited. I hope everyone who sees this is motivated and excited, and is gonna put yourself first. You have to take care of yourself so you can be a blessing to everyone else. So
Thank you. Thank you, Danielle. I so appreciate you coming on. And like I said, just sharing these tips and helping us really understand the importance of physical activity and exercise as medicine and getting our bodies moving. I think we kind of take it for granted, and we
absolutely.
think that we have to have equipment, or we have to, like you said, have a gym membership. And you literally showed us like stuff we can do on the floor in a chair. Everybody
Right.
has a chair, right? Everybody
Right.
has a floor.
Everyone has a
So
floor. Right.
it's free. So
It's free.
exercises that we can do to get our bodies stretched out and moving and feeling good and strengthen our core. That one, I don't know, the bird dog.
The bird dog.
Yeah,
Uh-huh.
that one I'm gonna work on that one too, because when you were saying, I was like, why am I so wobbly? And you're like,
Uh-huh.
because you need it strengthens
You
your
need to get a
core,
little,
it
yeah, you need
about
to
your
get a little
core
stronger.
and
And
that
you will.
balance.
Like,
So,
yeah, you
I
definitely
appreciate
will.
that, because we don't realize. I mean, I think we kind of overlook the fact that we can do simple things. It doesn't take a lot of money, extra
No.
time, and energy getting in our car, going somewhere to,
Nope.
like I said, work out. We can be physically active. We can move our bodies and get
Absolutely.
healthier and stronger at home, everyone. So thank
Absolutely.
you, thank you, thank you again for coming on and showing us these tips, and walking me through some new, exercises that I can incorporate into my daily routine, and I am going to be consistent because I heard what you
Yes.
said. We need to be
Uh-huh.
consistent. So I'm going to work on my consistency, and I'm just excited. So thank you. Thank you. I
And
feel stronger and, better already. So thank
yes,
you. I really
I'm so
appreciate it.
happy, and I'm so glad that you're empowered, and I know that you will take the information, and hope everyone else does too. Because, like you said, it's simple, meaning you don't have to pay for anything. And this is just the tip of the iceberg. There are literally hundreds more exercises that you can do to get yourself stronger. So, but this is just an introduction, and I'm so happy for you. And let's get
Thank you.
moving.
All right. Thank you. Okay. So thank you all for tuning in to another episode of Black Facts. I hope you learned something today about the importance of getting outside and just getting moving. Even if you don't go outside, just making sure you find a space in your home where you can get physically active and move your body, stretch your body out, and make sure that we're doing everything we can to stay healthy. So I hope you continue to follow us, subscribe at Black Facts on Instagram, YouTube, and Twitter, and also subscribe and like on our YouTube channel so you can stay up to date on new upcoming episodes. We're so excited that you came back to join us for another episode of Black Facts, and continue to stay tuned so we can all know the facts. Take care, everybody. I hope you have a blessed day.